Good afternoon, everyone, and welcome. This webinar is brought to you by Strategies 2.0, a statewide collaborative funded by the California Office of Child Abuse Prevention. Today's webinar is part one of a two-part series from ACE's Connection. Today's topic is Healing Communities Through Connections. This webinar is scheduled from 1 until 2:30 this afternoon. My name is Carrie Collins, and I will be your facilitator today. My role is to introduce the topic and the presenters to you, keep track of time, and help the presenters and participants in any way that they may need. In a moment, I will introduce the presenters to you, but first I'd like to go over a few of the webinar guidelines. So all of you should have a toolbar, a taskbar, that you can control with that little red arrow. You can either leave it open or you can close it as you choose to do. You can join us today either by telephone or by your computer microphone and speakers. Sometimes with the microphone and speakers, the sound is not as good as if you enter by telephone. If you do come on by telephone, there is an access code and a PIN number that you will need to enter. So in case you want to ask a question, then we can unmute you. If you do not enter the access code and the PIN number, we will not be able to unmute you. We will be using the chat box quite a bit today, and some of you have already used it to say hi to me and tell me where you were from and that you could hear me. So if you have any questions at all for our presenters today, we encourage you to enter them into this chat box, and they will be monitoring that chat box throughout the presentation today. You also can raise your hand. There's a little hand icon. If you raise your hand, what we will do is unmute you, and you can ask the question online to the presenters yourself. Don't worry about your sound. I have everyone except for our presenters and myself. Everyone else is muted, so you don't need to worry about background noise, that we're going to hear anything in the background. So with that said, let me introduce our speakers to you today. It's my honor to let you know that we have three presenters today from ACE's Connection. Karen Clemmer is the Northern California and Northwest Regional Community Facilitator. Danielle Prince is the Community Facilitator for the San Francisco Bay Area. And Laura Kane is the Southern California Community Facilitator. So we are well represented in the state of California. Gail Kennedy could not be with us today, but a lot of you may be really familiar with her. She's the Community Facilitator for the Capital Region and the Central Valley. ACE's Connection Community Facilitators work with community organizations and individuals within a geographic region to prevent, address, and heal the trauma of ACEs and build individual and community resilience. Community facilitators seek ways to accelerate existing initiatives and supporting local community efforts. Working in partnership with communities, they seek to accelerate the resilience and ACEs science movement. It is just such an honor to have these three women presenting today on this very, very important topic that all of us are involved in throughout the state, and very appropriate considering that April is Child Abuse Prevention Month. So at this time, I'm going to turn over presenter to Karen, and she will take it over from here. Karen, we can't hear you, so I don't know if you are self-muted. You are. You need to unmute yourself and then start over.
I'm sorry. Sorry about that. So this is, thank you, Carrie, for this warm handoff. And we are excited to be here. We hope that the information that we share with you is useful in your everyday life and with the work that you're doing in the communities. So ACES Connection, as Carrie shared, supports communities, and we really try to accelerate ACES science, which means what we really mean is we want people to hear about ACES, deepen their understanding, and then utilize that information to take action in their own communities in whatever way feels right to them. And as we all know, ACES stands for Adverse Childhood Experiences. And so our role as ACES Connection is a social network, which is a little different than a typical website in that ours is an interactive platform, which is why you see the dots and the lines. Our goal is to connect individuals, communities, initiatives, states, and others as they're working on the shared vision of ACES science. And a little bit of housekeeping. Carrie already addressed this, so I'm just going to skip over it. But I would like to share the next slide, which is how to become a member. And you would just need to Google or fill in ACES Connection. If you Google ACES Connection, it'll pop up, and then you go to the home page, and from there, you would click the join button, which is on the far right. To join, you will be asked a few questions, and the reason is we want to make sure everybody on the site is over 18. ACES can be a really tender subject, and we want to make sure everybody's well protected. So as you heard from Carrie, with the three of us will be presenting, and we will be starting with Danielle on starting and growing your ACES initiative. So our learning objectives, again, it's the ACES science and that it has 5 aspects. We'll move into trauma-informed principles and practices, and then we'll do an overview of ACES Connection, the communities, and some strategies. And we'll do a case study at the end of that. And then we'll have questions and answers and be happy to answer any of the questions that have come up for you. So at this point, I'm going to turn the screen over to Danielle, and she will take off from here. Thank you.
Good morning, or rather good afternoon, everyone. This is Danielle Prince. Again, I'm the community facilitator for ACES Connection in the San Francisco Bay Area. I'm going to be sharing about a little bit of the background in terms that we're all hearing. Some of you may be very familiar and others may not be as familiar. So I tried to get enough information that helps define these terms without going into too much detail for those that are just looking for an overview. But one of ACES Connection's goals is to make sure everyone is aware of the original ACES study as well as the long-term impact of childhood trauma on physical health. So we're going to first discuss a little bit of background on the ACES study of 1998. The photo you can kind of see in the background are of the authors of the study, the ACES study published in 1998. On the left of your screen is Dr. Robert Onda of the CDC, and on the right of your screen is Vincent Folletti of the San Diego Kaiser Permanente, and they collaborated on this study, which, as it says on the slide, they stumbled into what became one of the most significant public health discoveries of a generation. So we'll talk a little bit more about that. The ACES study was conducted on over 17,000 adults, and it's a key component was that it tracked health outcomes based on childhood trauma. It was a large, as you can see from the demographics here, it was a largely white and well-educated group, and what goes along with that is people had higher incomes and they had access to insurance. So, however, even despite these benefits, the study still found a huge impact of childhood trauma on your lifetime health risk profile. When you hear the term ACEs, it stands for Adverse Childhood Experiences, and you might wonder what those are. The ACEs study asked a number of questions on a psychosocial survey, but identified these 10 that you see on your screen as having a relationship between experiencing those, one of these 10, what we can call in shorthand, one of these 10 ACEs, and your elevated risk of certain health problems, as well as social and behavioral problems that we may have already suspected were linked to childhood trauma. But what this study showed is that it's also linked to physical health problems, independent of a genetic or family history, and independent of lifestyle factors. This graph kind of gives you another way of looking at those same ACEs and what aspects of our human development they reflect. The way the study was designed, they identified 3 types of ACEs, and then each type of ACEs has a few examples. So the 3 types are abuse, neglect, and household function, as you can see on the chart. And the forms of abuse that had the impact on health included physical, emotional, and sexual. The neglect, severe neglect that was physical or emotional, and as well as household dysfunction, which is the inability of people responsible, the primary guardian, people who are responsible for the well-being of the child, their inability to meet those needs. So you can see there's 5 items in that category. So you can see an untreated mental illness or substance abuse problem, witnessing a parent. In the original study, it said mother, but now we're understanding any parent to be treated, to witness that domestic violence against your parent, the impact of any loss of a parent through things such as divorce or death, and then having an incarcerated relative in your household also has this long-term impact. And these are those same 3 categories, and just a way of looking at the percentage that in the original study that were the people experienced. You can kind of see the range. So to kind of summarize the impact of the ACEs study, it found that there is, as I said before, a direct link between childhood trauma and the adult onset of chronic disease. So this was a surprise to the medical field, which had pretty much believed family history and lifestyle profile were the causes of disease. But the ACEs study found that you do need to look at childhood trauma, that it can have an impact directly. And as you noticed, about 2/3 of the adults in the study had experienced at least one of these significant trauma, significant enough to impact your long-term health. And of those, a vast majority, 87%, had experienced 2 or more. So they often didn't happen in isolation. And what was particularly significant about the ACEs study is that it had what's called dose-dependent outcomes, which means not just whether or not you experienced an ACE, one of the ACEs, and it would impact your health, but the more of those ACEs that you experience, the greater the risk to your health. And I should say, it's very clear that this is untreated childhood trauma that gets treatment and support. And we'll see toward the end of my section of the slides, we'll talk about resilience. Treatment makes a difference, and it actually changes a person's health risk profile when those childhood traumas are addressed. And as you can see here, that issue of your ACEs being dose dependent, the more ACEs, the greater the risk to your health. it's important to understand that kind of the distribution of the original ACEs study. So you can kind of see in this chart people with ACE scores of 1, 2, 3, even 0 is on here, 1, 2, 3, and then 4. And what is found is that with the ACE score of 4 or more, the health risk is particularly elevated. And you can see here a list of physical and mental health issues that have been identified as connected with ACEs, as well as behaviors. A lot of us already suspected that childhood trauma could be connected to these behaviors, but what the ACEs study helps do is put a number and quantify that. There's definitely a link. When you look at this chart, you can see that about a third of the population of this study had an ACE score of 0. And I should take a step back and just explain. There are 10 items, and you saw those 10 items in the previous slide. If you answer yes to one of them, your ACE score is 1. If you answer yes to 10 of them, your ACE score is 10. If you answered no to all of those questions, then your ACE score would be 0. So what you see here is about a little bit over a third of that study population had an ACE score of 0, which means that 2/3 had, as we saw in the previous statistic, 87% had at least 1. And we see that 12% of that population had that amplified risk that is found when you have 4 ACEs or more. So looking at the impact of an ACE score with 4 or more, that critical number. So you see several health behaviors, social behaviors, and you also see the increased risk of critical mental health issues such as attempted suicide, suffering from depression, and being diagnosed with dementia. And so this is another helpful slide to kind of let it sink in the impact of ACEs on your actual physical and mental health. So you can see that it was found that people with an ACE score of 4 or more had twice the risk of cancer as someone with no ACEs, had 4 times the risk of emphysema as someone with an ACE score of 0, had nearly 5 times the risk of depression, and 7 times the risk of alcoholism. My slides are going without me. Okay. This slide I find helpful to include. Occasionally, cities or counties will do their own ACE survey just to see what the profile looks like in their specific community. And so in California, Sonoma County did conduct their own local ACEs prevalence study in May 2015. And in the box, the blue box, were the Sonoma County rates, and then unboxed are the original, is the data from the original ACEs study. So you can kind of just get a sense. The 2 studies were not conducted in exactly the same way, so that they're not comparable in that way. But it does give you a kind of an idea of where the need is in that particular county when it comes to ACEs and how it differs. And highlighted in yellow are where the differences were particularly large. And so for those, I'll just read those. In the category of abuse, psychological abuse was a lot higher in Sonoma County than in the original sample collected on San Diego Kaiser Permanente patients. In the category of neglect, it was emotional neglect was significantly higher. And in the category of household dysfunction, you see the substance abuse, an absent parent, or an untreated mental illness in a parent were particularly acute for Sonoma County. And so it's good when communities do these assessments so you can see every community's needs around ACEs are not going to be exactly the same. And this slide just kind of gives you a sense of the and in a population of people who have ACE scores, what percentage of each of these social behaviors can be attributed to ACEs. A lot of research has been done since 1998 to look at ACEs in different ways, kind of narrow in on different categories of physical and mental health as well as social behaviors. So this slide just kind of gives you a glimpse of how having ACEs or ACEs can be attributed to a greater risk by as much as 52% experiencing domestic violence, so 78% experiencing IV drug abuse. Expanded ACEs is the concept you may have seen. You may have seen a tree like this before, to talk about the fact that on my slide, okay, I think it'll be the next slide. So this kind of is another look at the ACEs that I've already talked about, the kinds of experiences you might see in people who have an ACE score of 1 or more, and we know it amplifies after an ACE score of 4. And we also know that it's not shown here, but there's an impact on your physical health. A person with the ACE score of 6 and it's untreated, we see an increased chance of a loss of life expectancy of about 20 years has been found in the research. So these are there's physical impacts as well. So we're looking, the way people have begun to conceptualize ACEs is recognize that trauma can be caused by a number of sources. So the original ACEs are kind of looking at the private and individual outcomes. In the next slide, we see the roots. And so there's an organization called Building Community Resilience, Wendy Ellis, who writes about we need to look at the roots of the community ACEs. So there's not just adverse childhood experiences, there's adverse community experiences. And so those are the roots, and we need to look at those as well in order to better understand the sources of trauma. And you can see a range here from community violence to poor water and air quality, structural racism, lack of jobs, community disruption, historical trauma, and substandard schools are just some examples of adverse community experiences. And also, people have begun to look at how climate, a community's ability to resist some of the worst impacts of climate change. Not every for some of the same reasons we saw in the expanded community ACEs, not every community is equally resourced or positioned to withstand the impact of climate change. So we have to look at that when we're talking about the sources of trauma. So next, we're going to look a little bit into the impacts of toxic stress that's caused by ACEs. So beyond just defining, we'll look at a few of the impacts. It's important to define toxic stress. A lot of people use this term. Toxic stress is a non-medical term that helps people quickly understand how we know that childhood trauma affects health. That's really clear in the research. But what is the mechanism? How does that happen? Toxic stress is a way of explaining that physiology, which can get pretty complicated. There are many layers and many systems involved. So this definition, the biological response to severe and or repeated adversity, absent buffering support from a caring and trusted an adult. And that's both parts of that statement are really important because support makes a huge difference, and it's important to know that. If you're exposed to this toxic stress, the stress caused by experiencing childhood trauma, but you also receive support, there's a different impact on your body. There's a source at the bottom of the slide in case you want to look up the article yourself, but this gets into explaining exactly how childhood trauma disrupts the development of the brain and other organs, and just traces the entire physiological way this impacts babies and how it impacts you throughout the lifespan, really. And the long-term result is the increase in the risk of stress-related disease and cognitive impairment. And just a little bit of detailed resources are available to you as well. The biological mechanisms underlying toxic stress. So these are all, I include this information just because it's important to recognize these aren't just social impacts, but these are happening within your body. And this is why there's a health risk later in life. When there's no intervention to change the situation that is causing that stress or help people cope with it, it's having a continuous impact on your health. And this slide, and it's kind of small, but maybe when you get a printout of the slide, you'll be able to see a little bit better. It's great because it just shows you in the first column all the parts of your body and how they're and then we look at how they're impacted when your nervous system is what's called dysregulated. So when you're experiencing toxic stress, you have you're now in your attempts to cope with that stress, your ability to regulate your emotions becomes abnormal. And you can see as you travel through the different columns, when you're calm or just active and alert, you can see what you can refer back to the primary state column and see how your body would normally be functioning on each of those. Like your muscles would be relaxed, your respiration would be easy, but your muscles and respiration begin to look different when you're impacted by toxic stress. A different part of your brain gets involved and sets into motion different systems in your body, and this is unhealthy. So consequences of a lifetime exposure to violence and abuse. This slide just gives you an idea. There's been a lot of research done once this original study has come out. And so each of these categories represent a part of your health where the research has shown it's impacted by ACEs. So the original study looked at a set, and people have gone on to look at more. And it really works out to basically no part of your health is not impacted by your experience of childhood trauma. You can even see your dental health, your orthopedic health, allergies. People have been able to identify that the experience of toxic stress affects your entire body. But your DNA isn't your destiny. So the science of epigenetics reveals how the choices you make can change your genes and those of your kids. And importantly, so different family and community serving organizations have an ability to, and also through policy change, there's an ability to intervene and reduce the sources of toxic stress. So all roads lead to resilience. There's actually great research from the Center for the Study of Social Policy, which is cssp.org, that shows there are 5 protective factors that mitigate against long-term emotional and behavioral distress that comes from childhood trauma. And each of these are listed here. So it's concrete support in times of need, having social connections. That theme of support keeps coming up. Having support makes a huge difference. Increased parental resilience, and also the parents' knowledge of parenting and child development. And finally, the child's own social and emotional competence. So teaching children skills for coping with their own emotions. They may have become dysregulated, but there are things that we can do and interventions we can make that help them become better able to regulate their emotions, particularly when they're no longer in situations where they're experiencing forms of toxic stress, but they're still reacting as though they are. But you can teach them skills so they can recognize they're in a safe setting and they don't need those same kinds of responses. So knowing about ACEs changes what people believe about themselves. When people look at their behavior, they blame themselves, but understanding ACEs helps people realize that they coped appropriately given their experience, and they can actually change things and improve both their physical health as well as their mental health and social and behavioral outcomes. And so this slide is just I won't go through it, but it just shows some of the interventions that, and they're very simple, as you can see, that can help people better avoid the impacts of toxic stress. And ACEs Connection, one of the things that we really like to focus on in our both online and on the ground work are all of these components of ACEs science. So the impact on the body, the brain, and also the ability to heal and the ability of the body to change. And so our goal, and I just need, our goal is to recognize that through trauma-informed approaches, we can change from, instead of, you've probably heard this before, instead of asking what happened to you, instead of asking what's wrong with you, we can ask what happened to you. And the organizational version of that is, instead of just asking what is wrong with this organization or system, we can ask what has happened to the organization and system, and how can we help heal the organization and system. And so my colleague Laura Kane is going to talk a little bit more about how we can impact organizations. And I'm changing presenter, and it's not allowing me to, so just give me one moment. Okay, there we go.
Good afternoon, everyone. Thanks for joining us. As Carrie mentioned, I am the Southern California Community Facilitator for ACEs Connection, and I do a lot of work with organizations, schools, and communities around putting trauma-informed principles into practice. So I'm going to share some of what I've learned with all of you today. If my slides will advance, here we go. Let's see. There we go. So what does a trauma-informed organization look like? So as Danielle was mentioning, we all swim in the same ACEs ocean. ACEs are universal. It's the access to healing and trauma-informed and resilience building practices that may not be universally available. So it's really important that organizations implement trauma-informed and resilience-building practices for themselves, but especially organizations that are caring for people or directing other people caring type of work. It is fairly easy for our own buckets to become empty, and we need to build our own resilience. And especially if we are working with communities to build resilience, our organizations need to behave in the same way. So what might that look like? So I don't know how familiar you are with this. This is SAMHSA's 6 principles of a trauma-informed approach. And I like to use these as a framework, regardless of whether I'm working in a school or with a nonprofit or with a community across multiple sectors. So using this as a guide, begin to think about what you do in your own organization to create safety, to promote a sense of trustworthiness and transparency, to encourage empowerment, to foster collaboration, to create an environment that encourages peer support, and having an acute awareness of gender and historical issues and inequities. So keeping those 6 frames in mind as we talk about principles, because like many things, a trauma-informed approach isn't a checklist. I can't give you a set checklist or toolkit. There's a lot of ideas out there, but really using this framework and thinking broadly about what you're doing that fits within those and what things you may need to add. So SAMHSA also says that a trauma-informed organization and system realizes the widespread impact of trauma and recognizes the signs and symptoms of trauma in staff, clients, and patients and others involved in the system, as well as responds by fully integrating knowledge about trauma and ACEs into policy and practice and integrating it into their settings. And then I think also very important is to avoid re-traumatization. Many times the systems that families are involved in can cause more trauma, whether it be, schools or housing or mental health services or police. We need to be very aware that we avoid re-traumatization in our work. Some of the practices to keep in mind as you're thinking about this framework are your hiring and HR practices. So thinking back to those 6 principles, do they promote trustworthiness? Are they transparent? Do you have a system set up for peer support through HR if you need to go to your colleagues for help? Do you hire people with a trauma-informed lens? You want to hire people that already have some knowledge of trauma and ACEs, things like that. So keeping that in mind as you hire and as you have HR practices and policies within your system. Professional development. Does your organization include professional development on ACEs and trauma and self-care, not just the research and topic, but practices? Are you doing the work in your organization yourselves and learning how as you move through? Staff self-care. So does your organization prioritize and promote not just self-care, but collective care? So are there systems set up within your organization for breaks and support? So again, thinking about that like peer collaboration, and a lot of these things are very interwoven. So attending to team development and creating psychological safety are probably amongst some of the most important things that an organization can do to become and embody trauma-informed practices. So psychological safety is often described as being able to show up to work with your whole self, not just leaving part of yourself outside of work and having to feel protected and not being able to share with your colleagues, but coming to work and feeling safe that you can be yourself, that you can participate fully, that you have voice, that you are empowered to, take leadership when appropriate, that you have peer support, that you feel safe, physically as well as psychologically, but that in order to build that sense of psychological safety, a lot of team development work is very important. So authentic team building and time to be together, time to celebrate together, allowing for people to take walks, during lunch break or do a book study. There's a lot of small things that don't cost a lot of money that an organization can take into practice to promote that kind of collective self-care with each other. So one exercise that I do frequently, and it doesn't matter whether, like I said, whether I'm working with a school or a nonprofit, is take some chart paper, and I'm going to kind of walk you through this, but I would suggest doing this in your workspace during a professional development together. So take some chart paper and put it up around the room, and on each piece of chart paper, write one of those 6 principles from SAMHSA, and have a bunch of markers and have everyone kind of gallery walk around the room and fill in what practices that you already have existing in your organization that fit underneath each of the 6. So, for example, holding people accountable privately instead of publicly creates a sense of psychological safety, right? Because you're not being called out in front of everybody and feeling shame or embarrassment, which leads to all sorts of, icky feelings and resentment. So if that is a practice at your workspace, you could include that under the safety area. Encouraging an environment where it's okay to ask for support, you would put that under peer support. So spend some time with your colleagues and try to put down the practices that fit underneath each one, and then facilitate a discussion around first, patting yourselves on the back for all the things that you're already doing, and then look at the areas that might have the least amount of items and think about where you can prioritize your efforts in building up a trauma-informed organization where you are. And with that, I'm not going to pass it to Gail. I'm going to pass it back to Karen, who's going to step in for Gail. Okay.
Thank you, Laura, and thank you, Danielle. So we're going to kind of build on, kind of scaffold to what we've heard so far. We've heard about ACEs, the science, how it impacts people on the individual level, and then how it works within the community. But how do you take that information in your role and bring it along into the work that you're doing? So first, of course, we have to do a plug for ourselves, is to join ACEs Connection. And it's very simple, and you can see the information up there. And we want to honor Jane, who is our founder and publisher. So again, just Google ACEs Connection, go to the top of the page, and click Join. So when you're on ACEs Connection, you can see that there's different kinds. We have, on your left, you can see ACEs Too High. That's a different site. You would Google ACEs Too High and get to a whole different site. To Google ACEs Connection, you'll get to the page that you can see on your right. And they're different. They have distinct differences and some similarities. So the ACEs Too High is really a journalism site where they're sharing information and promoting published information. Whereas ACEs Connection, we're more of a social network site. I mean, what does that mean, social network? We want to promote connections across people, across peers, across organizations, across sectors. And what we mean by sectors is maybe somebody working in childcare, and then somebody working in the health clinic, and maybe somebody doing CASA work, having everybody come together to have that really rich shared discussion. And if you're new to ACEs Connection, welcome. And sometimes it's a little bit intimidating or difficult to navigate. It's not super intuitive, but it does have tremendous amount of resources. So I thought we could just take a moment and look at what some of those are. So when you're on the home page, on your far right, you'll see square boxes down the right-hand column. And if you scroll down those, each of those boxes can be clicked, and when you click on it, lots of information unfolds. So what we want to look at right here is how the Resource Center works. So to get where I'm at, you would go to your ACES Connection page, scroll down, and click on Resource Center. And as you can see that we have an amazing amount of information, from background information and science information, but also policy, legislation. We have materials in Spanish, and we have resources if you're working with parents on ACEs and parenting, education. There's a tremendous amount of information just because it's kind of emerging at this point in time, both in our area, but also at a statewide and national level around pediatrics and ACEs. So you'll find that each of those lines, each of those titles, those are hyperlinks. So when you click on it, it would open additional information. So say I wanted to go to the ACEs Science webinars because somebody's asking me to share information and I'm not really sure, or I have information and I want to make sure it's right, or I want to make it more interesting and add some extra parts to it. So if I clicked on ACEs Science webinars, a whole new amount of information would come out, and that information is there for you to use. That's sort of what's unique about us, is that we are sort of the hub where different ACEs Connection communities share their information, knowing that that can then ripple to others and accelerate that ACEs science movement that we've alluded to. So earlier I said we were a journalism site, and you're kind of, for me, I'm like, well, what does that mean, journalism site? That doesn't really, like, how's that related to ACEs? So I want to just kind of share a little story. That's journalism. So share a little story about the Lincoln High School. If you've seen the movie Paper Tigers, then you'll be aware of the school called Lincoln High School and the principal, Jim Sporletter. If you haven't seen it, or you'd like to watch it again, it is available on Amazon Prime for no cost. So Paper Tigers on Amazon Prime. And it's a really incredible story, really shared from the lens of both the teachers and the school staff. But I think what's really unique is it's from the lens of the students themselves in ways that we wouldn't normally see, because they were able to take video cameras home with them and weave that into the story and the behaviors they're seeing in schools. So just as you might be seeing behaviors with students or the children or the families you're working with, sometimes there's factors that you can't be aware of. And so what this story helps us know is that we need to be mindful of those and maybe approach things differently. And when Jim Sporletter learned about ACEs, he went to a conference, and it was such a powerful information. The information was so powerful that he went back to the school where he was principal at a continuation high school with really difficult kids and a lot of poor behaviors, bad behaviors, fights, etc. But he decided there and then he would just implement this trauma-informed approach. And through his leadership and the support of all of his staff, it was really a transformative experience for the students at that school. So that's a little bit of the story. Remember the journalism part? And sometimes we have to share stories for things to be of interest or make sense to people. But we also have sort of data wonks, and folks want data, right? So for those folks, there is a report, Lincoln High School, Walla Walla. So it does have all the data. They did an analysis. It's a pretty large report that really does show that as they implemented trauma-informed practices, the number of suspensions went down, the number of absent days went down. So there were direct linkages between the implementation of trauma-informed school issues and the students' performance. So you can see on the top it says communities. So this is one of the communities that's looking at trauma-responsive education and changing school culture. And you'll see the name Becky Haas. So I just want to take a moment to say, if any of us can post information on ACES Connection and share what we're doing. It doesn't have to be fancy. It doesn't have to be long. Kind of think of it even as a Facebook post if you want to. But the reason we like to encourage that is so that each person can learn from the other. So all voices matter and they're all important. So this is Becky Haas, and she wrote a blog about this issue, and it was on our community site. So I just wanted to share that. So she's part of the ACES in Education. So speaking of that, so what I really want to underscore is be brave, share some information, share a picture, whatever it is, because when there's somebody in a different community that might be thinking the same thing, and your information is just going to help give them a little bit of a nudge to take that next step, or vice versa. You'll read somebody else's story. So let's look at communities. What do you think of when you think of communities? For ACES Connection, we have geographic communities, which often is what comes to mind, meaning communities that are representing the town, the county, a state, or whatever. We also have interest-based communities. And these would be ACES in the faith-based groups, ACES in parenting, ACES in education, those kind of topics. And to find these communities, when you're on your ACES homepage, there'll be a series across the top, a series of tabs or options across the top. You'll just click on communities, and that will bring you to a long scrolling list of communities. And those are set up in a way that everybody can go look at them and glean golden nuggets from that information to share with one another and to maybe inspire your local work. So right there at the top, you can see it says communities. We would click on that and we'd get a really long list. And you can see the join in the upper right, join this community. And you can see that our address is super simple, www.acesconnection.com. And again, it's Googleable. So here's examples of communities. I kind of touched on these: ACES in pediatrics, ACES in foster care. And we've heard a lot about self-care and wellness. So we have practicing resilience for self-care and healing. And then we have trauma-informed and beyond. And really popular is ACES, parenting with ACES. So I'd just like to take a pause and go back to where, instead of what's wrong with you, what happened to you, and then to also recognize that many people who work in helping professions have had ACEs themselves. So to be sensitive that when we share this information, there's lots of opportunity for resilience building, for getting a sphere of support around you or around the family or around the child. So to have a sense of hope is really important. And along the way, we have to take care of ourselves, and you'll find some great examples here. So continuing on, from a statewide perspective, the first 5, California Association, so all the way across the state, is one of the communities. So if you're interested in one of your partners is first 5, then you could be a member of that group. And when you're a member of that group, you're able to place comments or to say things and have a little bit more interaction than if you were just perusing and looking at it and not being a member. And then the California Bridge Program, really important partner. If you're working in foster care or developing some of your trauma-informed practices, this may be an organization that you're also very familiar with or even working with. And then ACES in Action. This site is looking at statewide ACES efforts, lots around policy, practice, and those kinds of things. But when you click on this page, when you click on this community, you'll see this box. It will not have a red frame. But if you click on here, that's a hyperlink, and it'll bring you to a list of every community in the state of California. So if you're wondering if there's one in your community, you could go to this site and take a look. You can also ask your community facilitator based on where you're located and which one of us is in your area. And if you're not sure, just check with any of us. We're happy to make warm handoffs for folks. Oops. So this is the list where you can see the different counties and different groups. And you can also see there's a list of blog directories. I know when I was new to ACES and I was not having a journalism background, I kind of thought that a blog was a little bit intimidating, but a blog is really just sharing what you've learned. And the term blog is just the easiest way to describe that. So maybe you're sharing what you learned in the criminal justice area, like you went to a meeting and you learned something and found some new resources, then maybe you want to share under that tab, or under data or education, etc. And really importantly, so Strategies 2.0 is a really important partner of ours, and we're very proud to be here and to collaborate with Carrie and Alma and everybody. So if you join ACES Connection, your next step would be to look at the communities, find your local Strategies 2.0 on ACES Connection, and join that community as well. And they're sorted alphabetically. You can make the communities sort alphabetically, and then you can find it under the letter C. And just as Strategies 2.0 has different regions, we have an ACES Connection community for each of those regions. And that's a great place to store webinar materials like this one, some of the handouts. Then when you're back in your own workspaces or in the community and you need to find something and you know you saw it on a webinar, you could go to your strategies page and find that information that you were looking for very easily. Resilient Sacramento, these are some of the information they've shared, including these in the upper left. You can see that they've had significant translation of some of the resources that are available, parenting with ACEs, etc. So that is a resource. So if you have a family in your community that needs information in a specific language, you could reach out to Sacramento. That would be Danielle, or you could connect directly with the Resilient Sacramento folks. I see a question in the text box or chat box, and it says, can you be in 2 or more communities? And that's a big shout out is yes. Please join any that seem appropriate to you, any that resonate with you, and whether you're feeling it from a personal standpoint, or you want to bring it to your parish or your church or your synagogue, or you want to take it into your kids' school, or bring it back to your work. Join whichever communities resonate with you. And if you have trouble with too many emails, we're happy to help you get that sorted out. It's really not difficult, but it could be hard to do intuitively. So say you're So say you're in your community, and you can see this one says Sonoma County. So they had some funding, and they were able to train some people to bring the ACES message out into the broader community. But how do you know if that makes a difference? So this is a presentation tracker that we share at ACES Connection. So say in your community, you have folks who are already coming in together around ACES, and you're doing work, but you haven't developed a community site. Feel free to reach out to one of us. In the process of setting up a community site, we can offer this presentation tracker for no cost. Some of the communities that do use it find that the presentation tracker helps them, sort of like quality assurance, to see geographically where they're reaching, and also see what sectors, because it's color coded. So you can see that it's represented on a map with colors. And then you can take that information. If you're going to write a mini grant for somebody, then that information you can say we've done X number of presentations to this many people with this sort of, so it helps to build your story that has a persuasive feel to it when you're thinking about grants and mini grants. That's me. So really we're going to just transition. We're still talking about communities, but we're going to just look at a case study really quickly. And I love this quote that's on here. And, if you've ever seen Dr. Vincent Folletti speak, he speaks very quietly and slowly. And I think this is a perfect quote for him. He says, slowly, I have come to see that asking, listening, and accepting are profound forms of doing. You just have to let that resonate for a little bit. Really, connecting with people, connecting with others, really, that's what it's all about. And I know that Danielle was able to share this slide, so I won't put too much emphasis in it. I would like to point out that under abuse, when we're looking at the study table, the second line down, physical abuse, if you go to the right, you see 28%. That was with the original ACEs study. And with this group, it was 23%. So anytime I've used these performance equipment to help measure responses with participants, I've never seen the physical abuse be higher than the original study, but I've also never seen any of the other categories be lower than the original study. So what I'm saying is I think the spanking campaigns and that information has really made a difference, but we haven't really made a difference of getting the importance of protecting your children around these other subjects. So what I want to share is this important, I love this quote, and this is from the American Academy of Pediatrics, and they're really looking at building resiliency. So never before in the history of medicine have we had better insight into the factors that determine the health of an individual from infancy to adulthood, which is part of the life course perspective, a way of looking at life not as disconnected stages, but as an integrated across time. Sometimes we're like, oh, well, I'm early childhood person. I'm like, oh, I'm a high school person. Or, we identify ourselves or organizations or work based on our target population and based on those people in their course of their life. But let's kind of step back and look at them before they became, while they were younger, and then they got older and older and older to the point where wherever you interfaced with them. And it's also important to note that these children that are having difficult times, their parents probably were children that also had difficult times. So sometimes it's like there could be a sense of frustration with parents, like, why are they doing this? Or can't they stop or do something differently? But just being mindful that these are probably experiences that they also had. So it's shifting that lens and reshifting social norms. So with that, we're coming to an end. We are happy to take any questions that you may have. Again, you can see our geographic areas. We're kind of color-coded. So if you're in my region, in the green section, feel free to reach out to me. I'm happy to help you. I could help you connect with the nearest ACEs Connection group or set one up. The same thing with Danielle in the Bay Area, Laura in the blue Southern California part, and then Gail, who couldn't be with us today, but would be very happy to hear from you in the golden middle part of the state. So we also want to say thank you to Carrie, Alma, and Strategies, but also especially for you. We are super grateful that you took time out of your day to come be here with us and to learn a little bit more about what we do, but also about ACEs and how ACEs science could support or influence your work. And as Carrie said at the very beginning, this is the first of two, so feel free to sign up. Carrie would be happy to help you. Sign up now for our next webinar, which will be on May 21st. And this is where we'll talk about leveraging ACEs Connection to bring ACEs science into your community. So this should be pretty exciting. So now we're ready for questions. And while we're there, what I'm going to do is scroll one more, and you can see that we have lots of resources. And our slides and the handouts that are associated are available through Carrie, and you can get copies of those. So I won't stay on here, but I do want you to note that the last box on the webinar has lots of great resources. So are there any questions?
Karen, can you hear me okay? This is Carrie.
Yeah, Carrie, thank you, I can.
Okay, good. Yes, this is time that we want to allow for questions. I know sometimes people have to think for a moment before they come up with one. So let's give people that space to come up with a question or two.
Carrie, will the webinars be archived, and how would they find that if they were?
Yes, the webinars will be archived, and when we bring it back to me, I will show you how that works.
Oh, okay. Thank you.
I'm seeing if anybody has raised their hand. I don't see that.
Somebody has a question. Yeah. Good. On how do I connect with Carrie to get the slides? And then I see another one. I'm in San Joaquin County. How can we bring ACEs to the area? Laura, is that your area, San Joaquin, or would that be Gail?
I think it's Gail. This is Danielle. I think that's Gail.
Yeah.
Okay, Danielle. Okay. So you could reach out to Gail, and she would be more than delighted to talk to you and find ways to help you either connect with folks who may already be in the San Joaquin area, or to help you connect with other people who haven't yet come together but are interested, and as a way to come together. I think I skipped over the how do you get the slides, Carrie. I'm sorry.
That's okay. Do you want to turn it over to me and I can show them that?
Yes. Thank you. Here it comes.
Okay. Okay, everybody. So we have a strategies YouTube channel. I feel like we're really making it in the world. So if you go into YouTube and then under search for Strategies 2.0, we have a library of all of our webinars. Like, we are being recorded right now. So all of our past webinars that we have done is in this, including our learning communities. We also record, and they are in this library, and our Vehicles for Change series of 4 webinars that are now taking place are also in this library. Following this presentation today, within a couple of days, Alma Tovar, who supports me on these webinars, will be sending out to all of you a copy of this presentation today, and also will resend out the handouts that are in the materials section of the GoTo training. But we know that sometimes people have a hard time accessing these things in GoTo training. So she will send those out to you so that you will have the PowerPoint. There are 3 handouts, and YouTube channel is where is the library of our webinars are kept. Did that answer that question okay? I see. Okay, thank you.
Carrie, would it be okay if I go back to the San Joaquin question and respond with a little bit more depth? So if there's somebody, somebody in San Joaquin, they're interested and they're meeting up with other people who are interested. That's really the genesis of an ACEs Connection community, bringing people together with a shared interest around ACEs, building resilience, bringing the information into your community, to your families, etc., into your workplaces. That's the beginning of putting together an ACEs Connection community. And as community facilitators, Danielle, Lara, Gail, and myself are able to step in and help you have a site on our ACEs Connection platform, and there's no cost to do that. And again, the site can help you track presentations and other things. So our goal is to accelerate the ACEs science movement, and we do that by supporting communities big and small. Thank you.
Great. And then I'd also like to direct you to our strategies website, which is www.strategiesca.org. We do offer at no cost to anybody training on the protective factors that were mentioned in this presentation today. We have a full-day training on trauma-informed care, and we have a half-day training on building community resilience, the pair of ACEs. And we work really closely with ACEs Connection and with San Diego State University on all of our curriculum design and development to make sure that we're giving you the best information. So we cover the whole state, providing training and consultation at no cost. What is the website for those trainings? www.strategyca.org. And there's a whole list of trainings that we provide throughout the state. Are there any other questions? Following your participation today, you will have an evaluation that will be automatically sent to you when you go offline. We ask that you please take a moment to complete that for us. It really helps us in future webinars. We want to make sure that we're giving you what you need. If you have any suggestions on topics of webinars that you would like to see happen, please don't hesitate to put that in the comment section of your evaluation. So, to my presenters, do you have any final words that you would like to say?
I think I'd like to say thank you, and I hope that we have a chance to connect. This is Karen in Northern California. I hope we have a chance to connect in person or by phone or some other way in the near future. Thank you.
That would be great.
Yeah,
This is Danielle.
Go ahead, Danielle. Go, Danielle.
Oh, I was just gonna say, just echo what Karen said. I really always appreciate people taking the time to hear our presentations, and hopefully you find a way to connect with us in one of our regions. And we love to help people get connected, so please don't hesitate.
Yes, same. This is Laura in Southern California. So please connect with me if you're interested in learning more about bringing ACES science to your community in Southern California. I would love to connect with you. That's it.
And then I would like to thank the three presenters today. There cannot be too many of us doing this great work that needs to be done throughout the state and getting this information out to everybody. So we are all ambassadors in this work, and please pass this on to your colleagues, and let's get this word out about ACES Connection and building resiliency in our state of California. So with that, I'd like to thank everybody for participating today, and I will go ahead and close this webinar. To my presenters, I will be sending you a phone number so that we can talk to each other.